Okay.
Good morning. This is Cynthia. We were going to share a little bit of her story, a little bit unique because she had had a knee replacement a while back, done somewhere else. How long ago was that?
That was done about 9 months ago now.
Okay, and continued to have pain afterwards. And I think that the important point that we wanted to talk about here is that while her femur and tibia were resurfaced at the time of that procedure, her patella was not. I do routinely resurface patellas as part of a knee replacement. And what kind of problems were you having after that initial procedure?
I was no longer had the ability to go up and down the stairs. I could no longer drive one of my vehicles with a clutch in it. Just the overall mobility, just standing up from a chair, sitting down, it was just painful. I couldn't do that.
And I think that's pretty common. A lot of the things that we think about with that portion of the joint have to do with stair climbing and getting up and down from a low chair, and that can be painful. And we'll try to get some x-rays or other materials together to kind of demonstrate what we're talking about. That if you would show us your knee motion now, just straighten and bend a little bit for us. Okay, and obviously that's working well, and decreased pain now that we've resurfaced the patella. And this has been an improved function for you, improved quality of life with that.
Absolutely, my quality of life has changed substantially. After the first knee replacement, my quality of life had become worse because before that knee replacement, I was able to go up and down stairs painfully, and able to stand up and sit down. But after that initial replacement, I couldn't do it anymore. It was worse.
Well, glad we're getting you better now, and thanks so much for sharing your story with us. This is Cynthia's preoperative x-ray. You can see here the femoral implant. The patella is in place but is not resurfaced, so there is contact between the cartilage or bare bone of her patella with this metallic femoral implant. In a lot of instances, this can create a very painful situation. Postoperatively, we've now resurfaced her patella. You can see that it's tracking well within the femoral implant. This is a cementless patellar component. So you see the metal portion that affixes it to the bone. This space is filled with polyethylene, which is obviously much less painful against a metallic implant. And this has led to her pain-free recovery. This is a topic that can be a little bit controversial. There are reasonable surgeons that do not resurface the patella when they perform a knee replacement. I do this in virtually all of my knee replacement patients because it can be a source of pain, and it's best if that can be addressed at the primary surgery so that the patient doesn't require a revision. I think this increases each patient's chance of having an excellent outcome.